Hey, you guys just thought you were done with pharmacology, but you're not. There are a few little ancillary topics, so extras, that we do need to cover so that I can feel like I have given you a thorough education. So today, in the spirit of starting ClinPath 2 and talking about blood, and particularly about hemostasis, we are going to touch on a few of the drugs that can modify blood, more or less. All right, so the term hemantic. Hemantic means promotion of increased oxygen carrying capacity in blood. So that is the definition of a hemantic. Now, the hemantic to know is erythropoietin, which is a chemical released, you all know this, by the kidneys to tell the bone marrow to kick into gear. And you guys all know why anemia happens at this point. So, Epogen is the trade name for the classic erythropoietin that is used in human medicine, but there are a whole lot of varieties of erythropoietin out there. And one thing to recognize that in human medicine, particularly in athletics, erythropoietin is considered a banned substance because athletes can use it to increase their red blood cell mass, thereby increasing their oxygen carrying capacity to enhance athletic performance. That is why erythropoietin in all of its forms is considered a blood doping drug for athletics. Now, in veterinary medicine, we have a brand new erythropoietin that is actually FDA approved and labeled for non-regenerative anemia in cats with chronic renal failure. Notice, again, it has the CA1 designation. So that is a MUMS Act conditional approval that has come to market. And there is a picture of it right now. So it has a different mechanism of action. I am not going to expect you to know it. I just want you to know that it is basically a drug that enables the body to produce more erythropoietin. So its mechanism is novel. I'm not going to test you over that, but I do want you to be aware of it as you guys head out into clinical practice. All right, let's talk about iron. We know that iron is an important substance to bind to hemoglobin to allow for oxygen carrying capacity. And iron gets recycled in the body, but deficiencies in iron lead to deficiencies in hemoglobin. So it is critically and clinically important for iron supplementation in certain situations. Like, we don't use a ton of it in small animal. There used to be this brown liquid that I can't remember the name of that we would give for anemic animals that had also vitamins in it. But whether or not animals really need that, dogs and cats wise, is probably debatable. But there are different forms of iron that can be administered. The most common one is iron dextran. Now, large animal, iron does become a little bit more important, particularly if we're working with pigs. Pigs that are born in production barns are definitely at risk for iron deficiency anemia because they don't have contact with the soil. Remember, in talking about parasites of pigs, Ascaris huge, the roundworm of pigs. It is one of the biggest parasites and is a big cause of neonatal mortality due to verminous pneumonia. Remember that roundworms migrate through the lungs, and so these guys can get a secondary pneumonia due to the inflammation in the lungs. One of the ways that we combat that heavy parasite load in production medicine is to house these guys on concrete, something that is easier to clean because we can't clean the soil of parasite eggs. So when these piglets do not have contact with soils, they are at risk of iron deficiency. Pigs also have very high birth weights and very, very big litters. And so iron deficiency anemia is clinically significant in piglets. And so it is very important that these guys get IM injections of iron, and typically those are given shortly after birth. technician point, if you are ever working with pigs, it is super important that iron in this injectable form is given IM and not sub-Q, because it will stain the tissues sub-Q and cause a lot of irritation. All right, androgens. Hopefully you guys remember what androgens are. Those are sex hormones, and particularly we are talking about testosterone. But androgens are a potential treatment for anemia. They're not used commonly, and it's very rare that we're using them at all in small animal medicine. But you may see people want to do this. And the one that I've only been exposed to this Winstrol V once in my career. We had some in a primary care that I worked in, and used it mostly for muscle building in animals that were older and getting muscle atrophy. But Equipoise is an androgen that is used obviously in equine, hence the prefix there. Notice that these guys are controlled substances. So using them, we have to have all the restrictions that go along with controlled substance use as well. But whether or not they can help build red blood cells is a little bit debatable. All right, blood substitutes. We had these when I first started in practice, and then they went away, and I wish they would come back. If somebody could come up with a really quality blood substitute, a synthetic product that could be injected in animals that are anemic, think about what type of clinical implications that would have in areas that don't have blood donors or have a blood shortage. Our blood products are often on such short supply that this product, which historically this product that I'm familiar with was called oxyglobin. It was a red blood cell substitute. It was a cow product that was hemoglobin carrying. And it was dispensed in a modified lactated Ringer's solution. It was approved and still is approved. It came out right before I graduated here in 1999, but it's not on the market. The manufacturer is not making it. I'm not 100% sure why that is. I kind of wish it would come back in some situations, because it wasn't super cheap, but it was cheaper than a unit of blood products would be. But just know that those do exist. They have existed, but they're not clinically available right now. All right, coagulation. You had some videos on coagulation. You've had some lectures on coagulation at this point in time. Just a photo reminder of what that looks like. Anticoagulants. So we coagulate so that we don't lose blood, because if we lose blood, we lose oxygen carrying capacity. When we lose oxygen carrying capacity, cells die, then bodies die. So you got your intrinsic pathway from damage within or to the blood vessel itself. Extrinsic pathway is due to injury of tissues. All right, anticoagulant uses. You are going to be most familiar with these with respect to sample collection. So heparin is occasionally used in DIC. It prevents conversion of prothrombin, that's our factor 2 down in the common pathway, to thrombin. It is also sometimes used for laminitis in horses to prevent microthromboses at that level. Our EDTA, ethylene diaminitriacetic acid, EDTA, just say EDTA, purple top tubes. So that's a chelating agent. When we say chelating, that means it binds. And so it binds calcium in these situations, because calcium is extremely important for blood clotting. And it also chelates heavy metals. Coumarin derivatives, those are ones that bind vitamin K. We don't therapeutically use coumarin or Coumadin in veterinary medicine, at least in the small animal side. But you will see humans that are prone to clots that are put on quote unquote blood thinners, and it often is some sort of derivative of this. This binds the vitamin K pathway, which in our coagulation factors, 2, 7, 9, and 10. 2, 7, 9, and 10. ACD, acid citrate dextrose. This is not one that we use clinically, or citrate phosphate dextrose adenine, CBDA1. These are additives that we put in blood collection bags when we are collecting blood and blood products for transfusion. And then we have drugs that inactivate platelets, of which aspirin and clopidogrel are a drug to help prevent feline aortic thromboembolus in cats. All right, now drugs that potentially stop blood from clotting or make blood clots. So hemostatics promote clotting. Most of these medications and drugs, they are topical. So what these topical agents do to enhance clotting is they lay down essentially like a fibrin type network that promotes coagulation of blood. These tend not to work very well on large vessel bleeding historically. So small bleeding, small vessels, capillary bleeding. You may be familiar with silver nitrate, little silver nitrate sticks, also Quick Stop, which we use a lot for bleeding toenails. I have used a good bit of gel foam and Vetspon, and these are cellulose sponges, little square either cubes or flat little sponges that you can actually place into a wound to help lay that kind of netting for platelets to stick onto and to optimize bleeding. I have used like gel foam or Vetspon when I do enucleations, and you guys that have seen an enucleation know that those bleed a tremendous amount when you take out that eyeball. There is a relatively new product, though, that is on the market called Vetagel. I really, really, really like this product. Vetagel comes in a syringe that can be directly injected into body cavities. It is a sterile product. It actually does a very, very good job. Now, there are a few oral medications that we can use, what are parenteral anticoagulant antagonists, so they promote clotting. They are not good for like acute surgical bleeding, but if you have a concern that an animal may be more prone to bleeding, what these drugs do is they prevent fibrinolysis. So they prevent clots that form from being broken down. I have not seen a lot of protamine sulfate used, but apparently it's used for heparin overdose. But the one that I have used, and you may see on your shelves, particularly if you're in emergency clinic settings, is this one right here, which is aminocaproic acid. And aminocaproic acid is available both as an injectable and as an oral pill. So it prevents clots from breaking down. So if you have an animal that you are worried that seems like they bled more than normal in surgery, or you're concerned about an underlying clotting disorder, this may be a medication that you see used. It is generally pretty darn safe and comes in multiple varieties of dosages orally, not terribly expensive. All right, our big one, vitamin K1. I think you guys all know what it does at this point in time, but the actual name of vitamin K1 chemically is phytoadenine. Phytoadenine. It's vitamin K1. 2, 7, 9, and 10, guys. 2, 7, 9, and 10. It is our primary treatment for anticoagulant rodenticides. Remember that not every rodenticide is made equal. We have anticoagulant rodenticides for which vitamin K1 is the antidote, but we also have bromethylene, cholecalciferol, and zinc phosphate, and vitamin K1 does not work for all of those and rodenticides, just the anticoagulant ones. All right, so drugs that break down clots, thrombolytic, so destroys clots. They are used to help dissolve thrombi. We don't use these much, if at all, in veterinary medicine, but you will and probably have heard them referenced in human medicine, what we call clot-busting drugs. So people that suffer an acute stroke or an acute myocardial infarction, things like that, they will often use these clot-busting drugs. They are crazy expensive, which means that we don't have access to them in vet med. The other hard thing about disorders of thrombi is outside of our cats with hypertrophic cardiomyopathy, it is really, really hard to definitively diagnose clotting or thrombus, essentially. The names of those thrombolytic drugs are streptokinase and urokinase. You might find some use of this in tertiary institutions like our academic institutions like Mizzou. They may have access to something like this there, but day-to-day, everyday practice, you're not going to see these drugs on the shelves. And that's it. So 14 minutes of drugs that affect blood clotting, and hope you enjoyed. See you later.